Hey, happy Wednesday, ladies. How's it going? Welcome to Wellness Wednesday. I will start out by going through. Let's say my disclaimer as I do this live event. So anything that I say tonight is just health information. It is not supposed to be specific health advice. And I would also say do not start or stop taking or change the way you're taking any of your medications. And if you feel like you need to do that, please contact your prescribing practitioner so that they can help you make the appropriate adjustments. And let's see, attending this Wellness Wednesday does not establish a doctor-patient relationship. Okay, there we have it, out of the way. I hope everyone's doing well this evening. We are, I should say, I am constantly reminded of the amazing power of our bodies to heal. And the topic for tonight's discussion, it came up, well, it's been on my mind a lot because I've had a couple of patients recently have some issues with pain, and one of them with specifically some symptoms, not necessarily pain, but digestive discomfort relating to a structural issue that I will talk about tonight. And I was trained as a DO, or a doctor of osteopathy, which many people ask, well, is that some version of a chiropractor, or what is that? And it's I'm asked that because it is somewhat similar. I'm trained as a medical doctor, or I was trained as a medical doctor, but I was also trained in more hands-on manipulation, similar to chiropractic, right? And that all started when, and I'm not going to go with a whole lot of names, but that all started with some doctors back in the day who had the idea that if our bodies were better aligned, and if there were, and if we took care of the structure a little bit better, then that would help to improve function. And this conclusion was drawn because of what they were studying with the nervous system. And so that means our brain and our spinal cord and the nerves that come out of that. And so anyway, chiropractic was born, and then osteopathic medicine was born, where allopathic medicine already existed and was more, focused more on antidotes and medications and things like that to fix your health. So I'm going to talk a little bit about the importance of getting aligned, of maintaining proper alignment, because there is absolutely a relationship between structural integrity and function. And let me talk about more than just I'm not talking about just function, like mobility function, the ability to walk long distances, jog, without pain, get up off the floor if you fall. I'm talking about, so not physical function necessarily, the ability to just do everything you need to do physically, but I'm talking about organ function, how that is affected by the structure of our spine and other tissues. So I'm just going to try to describe the best I can without really giving a whole lot of visuals, that the relationship between our nervous system and the rest of our body. So we have, our brain is connected to the spinal cord, and then out of the spinal cord, even up top by the brain, are these various nerves that come out, okay? And these nerves go to specific parts of our bodies, including our muscles and organs. And so there is, in fact, at every spinal level that, say you've heard of maybe cervical spine or thoracic spine or lumbar spine, our backbones, that's the spine. There are various sections and levels that correlate, that correspond to specific muscles and organs. Okay, so one interesting thing, some of the symptoms. Let me also talk about the symptoms that might lead you to think, well, maybe there is a structural problem. Pain is always a good symptom to to let us know something's wrong, and depending on where the pain is, it can certainly it can certainly correlate to something structural and that needs to be addressed. Digestive symptoms, certain digestive symptoms can also clue us into possible structural issues. Heart symptoms, so palpitations, and chest pains. Certainly menstrual symptoms, bad cramping or irregularity in the menstrual cycle. Headaches it's pain, but it's, depending on where the headache is, what it's like, that can also correlate, point to some structural issue. So back to digestive, constipation, even diarrhea, heartburn, reflux. These are all symptoms that have a possible basis in structure. So, well, and there are more, I'm sure. There are many more that we could list, but so let's say, let's go back to this idea, try to create this visual in your head. If you can visualize the spinal cord coming down off the brain, and the nerves come out between your vertebrae, each bone in the spine, and the nerves come out, and some go to muscles, some and branches of those go to organs. So every organ has a specific level. And so if you're having, say, heartburn or reflux problems, you might have a corresponding structural problem at the level of T8, T9, maybe T10. So in your thoracic spine, that's the part of the spine between the neck, the cervical spine, and the low back, the lumbar spine. And so, kind of most of the way down on that thoracic spine, you might have a problem. Now, in chiropractic, they call it a subluxation. And if you can just get an adjustment and move that, sometimes that's enough to relieve those symptoms. It's really interesting. But those problems often go out. Okay, they often go back, and there's some reasons for that. That could usually mean that there's something actually internal that needs to be addressed. One good example of a of a digestive problem or a structural problem in the digestive tract is a hiatal hernia. And some of you, many of you who I've met with have told me that this is an issue that you have. For some of you, it's not necessarily a big deal, but for some, it really can be a big deal. And to some, and I'll tell you about one of my patients who later on who this was a really big deal for. It can really cause these symptoms like palpitations. It can cause, early satiety. You get full really quick when you eat, or you have a lot of heartburn because food gets stuck easily. It doesn't get into the stomach as easily. Hiatal hernia is where part of the stomach goes up through, there's a hole in your diaphragm muscle. It's like your breathing muscle. And there's a hole in it where many important things pass through from the bottom and from the top. Things like your aorta, your main artery from the heart, your esophagus, your various nerves, vagus nerve among the most important there. Your vena cava, the blood vessel that's coming up back to the heart from the body. So many very important things go through. And part of the stuff is also those pinch that nerve, that vagus nerve, causing some periodic excitement in the heart, and then why your heart can beat really fast, and it makes you anxious, and you wonder what's going on, and it's all this time it's that hiatal hernia. You can get slowing of the bowel because of that. Because if that nerve is being pinched, you're going to have slower, like it's called peristalsis, or movement of the colon, intestines and colon. And well, that's going to result in constipation. Or it could irritate the nerve enough that it sends more signal through, and that can cause diarrhea. So it's really strange, like all these things, like who knew? Many headaches are due to many headaches and what you might call like a migraine, tension migraine headaches start like right back here in the back of the neck, down into the trapezius, this muscle here. And when you eat a food that you're sensitive to, or that maybe your stomach has difficulty with, because there's a relationship between those structures as well from embryo, you get the stomach fired up, then the nerves that attach to your stomach from the spine, that sends a signal through those nerves back up. And those same nerves, there's like I said, there's this connection to those muscles, and those muscles tense up. And then you get this annoying headache, or it could even be pretty severe. And I used to get these. These are the types of headaches I used to get. So I found that I had food sensitivities that I had to solve in order to solve my headaches. So it's fascinating that there's this relationship, and we really would do well to get periodic care by through chiropractic care, who can take care of these kinds of issues, through osteopathic manipulation treatment, OMT. Body work is often very helpful, massage and lymphatic work. And so we can use these tools to treat some of these problems. And I know a lot of you have. I know a lot of you have gone to these types of folks and these types of practitioners, and it may help for a little while. or temporarily, and then you have to kind of go back and do it again, or it requires repeated treatments, which is fine. But so if that doesn't work, there's something else going on, and there's a need for certainly comprehensive testing to help you get really to the bottom of these issues. So again, I'm a huge proponent of getting this type of work done, and getting this type of work, this body work, this chiropractic, go to a reputable chiropractor, and there are a lot of them. And I usually have no trouble with chiropractic unless they're just manipulating so frequently that you really don't have time to heal. Osteopathic manipulation, like I said, I really am a big proponent of that, and I used to do a whole lot more of that because of this structure-function relationship. Menstrual. So let's talk a little bit about that. Usually, there are issues with pelvic alignment. So the nerves, again, going through the sacrum and the low back down to those organs. Yeah, those problems can be caused by structural abnormalities. I just think it's really important to emphasize the need to take a holistic look at your symptoms. When you have all these these different types of symptoms, could a structural malalignment be the issue? And it certainly could be. I am going to so I'm going to tell you about one of my patients. I'm deciding which one to tell you about. So let's tell you about Brandy. So she had issues with a hiatal hernia, and it was really causing some issues. So she was getting palpitations and wasn't able to keep a lot of food. I mean, she could eat, and she wasn't getting like vomiting it up or anything, but she would just get full really quick. And she was having trouble with her supplements, like keeping her supplements from causing issues. She would have some nausea, some problems with taking the supplements, and things. She wasn't making a whole lot of progress in the right way. So recommended that she see about getting this hiatal hernia reduced. And sure enough, she was able to get it manually manipulated to basically, like, not detach, but reduce it, get that bulge to come out of that hole by downward pressure through the right under the xiphoid process, right under the ribs. And it freed it up. And she, one other symptom of this can be difficulty getting a deep breath. And so this was really helpful. She noticed immediately that she was able to get a deep breath. And she started tolerating, taking the supplements more, and things just started to improve. This has been super helpful in many, actually many of my patients. Now, I have had to recommend surgery to keep a severe hiatal hernia from recurring, because it will pose a problem. So in some cases, surgery is actually really necessary. I want to tell you about Larry, one of my patients who also had really bad reflux and had been stuck on omeprazole for his hiatal hernia for years. And, our goal was to try to get him off of that because it impairs digestion. Omeprazole, these PPIs, proton pump inhibitor type medications, prevent acid production in the stomach, which then prevents the stomach's ability to turn on enzymes that digest your food, the meat, the protein that you eat. And so, well, we worked on his hernia. That helped. I mean, he had known he had this hernia, and he was actually toying with the idea of getting surgery. He was in consultation with his primary care physician, and the manual start tolerating his supplements better. In his case, he didn't really have a racing heart, but he did have some shallow breathing, and he started feeling much better, and his reflux went away, and he was able to stay off the omeprazole. So, if this seems really strange, I mean, it's just a matter of structure, function. So, all right. So I think I'll leave it there, but I would like to go ahead and answer questions if you have any. And so I'll take, maybe 3-4 questions. If you don't have any, that's fine. If you want to put them in let's see if anyone has any questions. Well, there is a question. How do we make sure we stay in balance without needing to see a chiropractor all the time? I feel like I'm always in need of an adjustment, and I don't know what I do without a doctor around. That usually means something else is going on deeper, and we'll probably need some testing done. Adjustments don't hold a lot of times if there's something else going on. Sometimes adjustments don't hold unless you are doing the right kind of exercise to keep your muscles in good tone. So there is that aspect of it. And that's one reason why certain exercise is very important. But at the same time, if you're needing a lot of adjustments or frequent adjustments, then that is definitely a sign that you need to get testing, get the comprehensive testing to figure out what is going on.